I've actually wanted to be a physician since I was just a little kid. I was born with a club foot, and I had several surgeries when I was very young. And during one of the surgeries, I was in the hospital. I got a chance to go to the lab and look at blood under the microscope, my own blood, and I just thought that was really cool, all the stuff I got to see. So I'd always wanted to be a physician. Went off to college and off to medical school, and went into internal medicine. I liked the idea of having to, knowing about a lot of different diseases and so on. But I also wanted to do some procedures, and gastroenterology is a very nice mixture of the two. You spend a lot of time dealing with cerebral problems, diseases and so forth, but you also spend time doing procedures to help fix things. So I liked both, and that's why I went into gastroenterology. I joined McFarland Clinic way back in 1994, and the real answer is probably my wife. She is from the Midwest. I was originally from California. I'd gone to medical school in St. Louis where I met my wife. I was in the Air Force then, in the Medical Corps for about 7 years or so. We were looking around places to go. Joy, my wife, wanted to stay in the Midwest. I enjoyed St. Louis very much. We wanted a smaller town, but maybe a university town. Also wanted to be in a large multi-specialty clinic, which I have thoroughly enjoyed. It's nice to have physicians and providers from all the different specialties to give us with, talk over things with, and so on. So it met all of our goals. The question is, what things have changed over the years? I would start with the things that haven't changed. That's the importance of taking care of patients and listening to patients. The diseases are pretty similar. They do change a little bit. For example, when I first went to medical school, AIDS didn't exist. And a disease specific to gastroenterology called eosinophilic esophagitis hardly existed, but became very common as time went on. But what didn't change is the enjoyment of talking to patients and figuring out their diseases. Some of the treatments have improved over the years, of course, but the general idea of a doctor-patient relationship, that's been the same the whole time. For colleagues, I would say keep reading medicine. Never stop reading medicine throughout your whole career. That's how you stay sharp and so on. Staff at McFarland Clinic and at Mary Greeley has been outstanding. I'd say keep being the outstanding people that you are. And patients, of course, are wonderful. That's what I'll miss the most, is interacting with my patients.